Dr. Irish, we've talked about what is dysphagia. How do we diagnose dysphagia? What are the options?
Well, the best possible situation is when you have a collaborative team working together to both diagnose and ultimately care for a patient. This obviously can include an otolaryngologist, head and neck surgeon, or ear, nose, and throat surgeon like myself. Of course, a speech language pathologist, particularly one with an expertise in dysphagia like yourself. Finally, a gastroenterologist who is a specialist, particularly in the area of esophageal and stomach issues, particularly one that has an expertise in dysphagia, can all be involved in the diagnosis and care of the patient with dysphagia. Diagnosing dysphagia often requires tests, uh, particularly a swallowing X-ray called a videofluoroscopy study. This involves drinking a liquid such as barium or gastrographin and allowing a specialist, a radiologist, and often a speech language pathologist to examine the swallowing as the patient is swallowing. A test called FEES. FEES stands for fiberoptic endoscopic evaluation of swallowing. This is where an otolaryngologist and sometimes a speech language pathologist will introduce a small camera on a tube through the nose and pass this into the upper throat and examine the structures of the throat as the patient swallows and during the swallowing process. And that can be a very helpful diagnostic test as well. Another test called manometry. This is a test where a small tube is passed through the throat and into the lumen or cavity of the throat and esophagus and measures the muscle strength as a patient swallows. And that can provide value with regards to the muscular contractility or contractions that occur during the swallowing process. All of these tests can contribute to helping diagnose and helping, therefore, treat a patient with swallowing problems. None of these tests are painful. Some of these tests are slightly uncomfortable, but they're very helpful in the management and ultimately the diagnosis of patients with swallowing problems.